Hello, I am Dr. Khalilah Jefferson, DNP. Today, I would like to discuss nurse burnout, a patient safety crisis, a nurse's perspective. Imagine for a moment that the person in the hospital bed is not a patient. It is your child, your mother, your father, your aunt who taught you how to pray, or your uncle who never missed a birthday. Now imagine that the nurse assigned to care for them is exhausted, not tired in the way a good night's sleep fixes, but depleted, emotionally threadbare, cognitively overloaded, still competent, still licensed, still showing up, but barely holding the line. I want to talk to you about nurse burnout, not from a staffing perspective, not from a budget perspective, but from a human one. From the side of the bed where someone you love is lying. I am a nurse, and burnout does not make us careless people. It makes us dangerous in quieter ways. Burnout does not mean we stop caring, it means we care while running on empty. And when you are treating someone's child while your emotional reserves are gone, the margin for error narrows in ways most patients never see. Nursing is not task work, it is vigilance work. It is noticing the change in breathing. It is hearing fear underneath a patient's question. It is recognizing when pain is not physical, when silence is not peace, and when I'm fine is a warning sign. Burnout erodes that vigilance. Research consistently shows that emotional exhaustion is associated with miscare, things that are not dramatic enough to trigger alarms, but critical enough to shape outcomes. Delayed pain medication, incomplete patient education, subtle symptoms dismissed as anxiety, a call light answered a few minutes too late. If this were your child, those minutes would matter. Burnout also fractures communication. When nurses are cognitively fatigued, our explanations shorten, our tone flattens. We give information instead of understanding. Patients leave conversations confused, but afraid to ask again. And confusion in healthcare is not neutral. It leads to non adherence, complications, readmissions, and fear. From a patient's perspective, it feels like being alone in a system full of people. There is also a harder truth we do not talk about enough. Burnout creates moral injury. Moral injury happens when nurses know the right thing to do for a patient, but the system prevents it, when staffing ratios are unsafe, when documentation takes precedence over presence, when we move on because we have to, not because it is right. When you are treating someone's mother under those conditions, you feel it in your chest. You feel the betrayal of your professional identity. And over time, that injury calcifies into emotional withdrawal, not because we stop caring, but because caring hurts too much. Patients experience this as coldness, as indifference, as being processed rather than cared for. And that perception alone can worsen outcomes. There is strong evidence that patients who feel emotionally unsupported experience more pain, more anxiety, longer recoveries, and poorer satisfaction, even when the technical care is correct. So let me be clear, burnout is not a nurse problem. It is a patient safety problem. It is a dignity problem. It is a trust problem. When nurses burn out, patients lose more than empathy, they lose protection. Because nurses are the last line of defense between a vulnerable human being and a complex, fast moving system that does not slow down for fear, grief, or love. When you ignore nurse burnout, you are not just risking turnover, you are risking someone's child, someone's father, someone who matters deeply to someone else. The solution is not resilience training alone. Nurses are already resilient. We have proven that. The solution is designing systems that recognize that sustained human care requires human capacity, that presence is not a luxury, that attention is not optional, that empathy is not infinite. If we want better patient outcomes, we must protect the people whose job it is to notice what machines and metrics cannot. Because one day you will be on the other side of the bed. And when that day comes, you will not ask whether the nurse charted on time. You will ask whether they saw your loved one as human and whether they had enough left in them to care.